Hi, doctor. For the first questions, in order to develop the blockbuster drug, firstly, the interested disease that I'm going to treat is identified. Next, the biological target of the disease is identified. After that, the hit molecules is discovered and the lead compound is identified through the high throughput screening. After that, the structures of the lead molecule is manipulated to increase its potency. And we should make sure that the optimized drug is fulfilled with the pharmacological properties such as the potency, drug administration, distributions, metabolisms, extraction, the toxicology, bioavailability, and safety. Then the drug candidates will undergo preclinical trials and phase 1 to phase 3 clinical trial as well. And finally, the drug will be sold. The next question is to explain the strategies to develop the most potent drugs. In order to develop the most potent drugs, firstly, the computer-aided drug design is applied in virtual screening in order to develop the most potent drugs. The virtual screenings can be in the ligand-based virtual screenings or structure-based virtual screening. The ligand-based structure screenings is a type of the screenings where the structures of the biological target is unknown. Hence, the structures of the drugs candidates can be developed based on the knowledge of the other molecules, or we can obtain the pharmacophore models through the quantitative structures activity relationship study to screen the database. The other molecules is used to develop the pharmacophore models so that we can have the minimum necessary structure characteristics that a molecule possesses in order to bind to the targets. The next virtual screening is the structure-based virtual screening. Structure-based virtual screening is a type of the screenings where the structures of the biological target is known. Hence, we can obtain the three-dimensional structures of the biological target through the X-ray crystallography or nuclear magnetic resonance spectroscopy. If the structures of the biological target is unknown, we can obtain the structure through the homology modeling or homology study, which is a method of identifications of one or more non-protein structures likely to resemble the structures of the query sequence, and on the productions of the alignments they match the residues in the query sequence to the residues in the template sequence. After we get the 3D structures of the biological targets, we can estimate the binding of the drug candidates to the biological targets through the docking methods. Only the drug candidates which has the higher affinities towards the biological targets will be identified. Although the virtual screenings is just an estimations, but it can helps to filter out the candidates which has the high affinity towards the targets. Hence, it can help to increase the potency of the developed drugs. So that's all for my answer for the questions 1 and 2. Thank you.